fibromyalgia, long COVID, and chronic fatigue syndrome with ME. Can we really tell the difference between these three conditions? In this video, I'm going to be talking about three conditions that in the last 4 to 5 years have caused a lot of challenges to clinicians and to patients as we now understand more and more about these conditions. Thanks to the research that has gone into long COVID, we are now realizing that actually it can be quite tough to be absolutely precise and see what is the one clear diagnosis. Certainly in my clinical practice, I'm getting a lot of patients who have had fibro before but now have got a diagnosis of long COVID, or who have got all three labels and they come to the clinic with these three. And I wonder really, how is it possible to make these diagnoses parallelly? But so let me give you a better way of trying to understand these conditions. Why is that important? Well, treatments do change. There are some treatments you'd want to give in the context of long COVID, and there are some treatments you'd not want to do, especially if it's just chronic fatigue alone. So how do we understand the similarities and the differences between these three conditions that actually have got a lot of similarity between them? So what's broadly similar to all three of them? First of all, fatigue is a very common presentation in all three groups of patients. The second, pain. Pain is actually surprisingly common in both chronic fatigue and long COVID. You were sort of thinking that chronic pain is most common only in fibromyalgia, but in long COVID, chronic pain has been reported in up to 60 to 70% of patients. And in chronic fatigue patients, after a certain number of years of having fatigue, they start to develop pain for a variety of reasons. So in many people, by the time chronic fatigue patients present, they also have pain in multiple areas of the body. So pain and fatigue are two common similarities. There is often a disturbance in the motor or in the autonomic nervous system. So people can often have symptoms of instability in the nervous system, especially that part of the nervous system that controls your unconscious functions like your heart rate, your blood pressure, your heartbeat itself, and your tummy function. All of this collectively is called dysautonomia. And dysautonomia is actually more common in long COVID patients, followed next by chronic fatigue patients, and then by fibromyalgia patients. So it doesn't mean it does not happen, it's just less common in some groups. These are usually the biggest similarities that I see. There are other similarities as well, which you can read about there, and they're available when you Google anywhere. But these are the three big ones: the presence of pain, fatigue, and autonomic functions. What are the differences? Well, the differences often come in how it has started. In another video, I've gone through the various reasons why, or the causes why fibromyalgia occurs. You can have it after a traumatic event, a major surgery, or some kind of medical event, a physical trauma or an emotional trauma, and sometimes even adversity in childhood. These are often the most common reasons for fibromyalgia. Another relatively common reason for fibromyalgia to happen is the presence of another autoimmune condition. So patients with rheumatoid arthritis or psoriatic arthritis have almost a 25 to 30% chance of developing fibromyalgia. So having pain in the context of an autoimmune condition that's widespread and fatigue, that's one way to make a diagnosis of fibromyalgia. Chronic fatigue and ME particularly are most common after a viral infection, either an Epstein-Barr virus or a tummy bug infection, or sometimes conditions like Lyme. That is usually a post-infectious situation wherein you have fatigue as the dominant symptoms, some amount of pain, and then all the other symptoms that come through. That is often the time to make a diagnosis of chronic fatigue syndrome or ME. Now, long COVID, I think the most common and the way we've made the diagnosis of long COVID is actually the presence of an acute COVID positive test. That is something that the guidelines as well in the UK have said that a person should have a COVID-like infection with either loss of taste or smell, with the changes of fatigue or pain, and after you've had the acute infection beyond 3 weeks and you're starting to have these symptoms of fatigue and the taste and smell doesn't come back, or you have pain in different areas, sleep disturbances, concentration problems, in that context, you can have long COVID. So you can see that the history is very important in looking at the difference between these three conditions. But in terms of the actual symptoms, there's a lot more similarities because they're broadly neuroimmune disturbance conditions. So treatment for all these three as well, there's a lot of similarities because you're trying to calm the nervous and immune system down. So I hope you enjoyed, or at least got a chance to understand the differences and similarities between these three conditions. Thank you for listening to me, and I'll see you in the next video. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.